Charcot foot is a rare complication of diabetes where the bones can disintegrate from what often is very trivial pressure. The reason why Charcot occurs isn't fully clear as yet, but we are very aware that the underlying mechanism requires neuropathy. Neuropathy, which is nerve damage, can often make the foot less sensitive to pressures, and often you can end up walking on a damaged bone, which would then damage and cause further problems to the bone. What happens when you get Charcot is that you often get a foot swelling. The foot has suddenly appears swollen one day. Often in lighter skinned people, it comes across almost like red, or you may find in darker skinned people, the color changes into a more darker hue, and occasionally there is pain. Often doctors and other non-specialists can mistake Charcot for more common conditions such as infection, cellulitis, or a blood clot. The diagnosis of Charcot can often therefore be delayed. When we see anybody with diabetes and a swollen foot, we should think of Charcot. And the next step in the diagnosis of Charcot would be to have an X-ray of the affected foot. And the quicker you have the X-ray, the better it is in terms of getting a diagnosis and ultimate management. The X-ray sometimes can be normal. If you have had very early Charcot, and the bones haven't completely started to disintegrate, you can find an X-ray which is normal. But if the foot is swollen, we often go ahead and do an MRI. And an MRI is far more sensitive than an X-ray and can show changes to the bone, in particular swelling within the bones, much more easily. If the X-ray is already abnormal and indicative of Charcot, you know the changes have already occurred to the extent that the bones have now started to change. Either way, with very early Charcot or very early active Charcot, once we've got the diagnosis, the next step is to try and protect the foot. And protecting the foot is done by putting a total contact cast, a bit like how one would manage a fracture. We would put a cast on it. We would ask you not to put too much weight through it. But the aim is not to keep you non-weight bearing or not put weight on it forever, but initially get a grip on the healing process. Sometimes, despite all this, the bones still can crumble. And therefore the foot then starts changing shape. If you look on the internet and Google Charcot foot, you may find that imagery of very swollen feet, very deformed looking feet, which are indicative of quite advanced Charcot with bone architecture that has now significantly changed. We would hope that after listening to this video, you would highlight any swelling in your foot to any of your doctors very early on, asking them whether it's Charcot or not. But if you have been unlucky enough to have Charcot some time back and have significant bony changes, which are now causing you to have an ulcer, these can still be treated. What we offer in my practice is we work with orthopedic surgeons and plastic surgeons and offer the ability to provide a more long-term limb salvage, functional, taking into account your ability to continue walking and maintaining that function. And that would be the next step in the management of what I would call a complicated Charcot. Once you get the Charcot, it can be permanent, but if you can detect it early on and your foot hasn't changed in shape, then we can treat it and control it even before it becomes permanent. But once you've developed deformity of the foot bones and the architecture of the foot has changed, that change, unless corrected surgically, truly is permanent. This is a very individual question, and also depends on where you are in the phase of your life. If you're young and active, people who have Charcot foot may suddenly find themselves much more limited. Limited in terms of them going to work, limited in terms of ability to do what they love, going for long walks, etc. Even those who are older are not spared of these challenges. And of course, as you get older, you may find yourself needing additional aids, such as wheelchairs, to counterbalance the impact on the other leg and or the other foot. One must remember, in about a third of our patients that we look after, there is a Charcot occurring on the other foot also. So it's quite a major diagnosis, something that needs good early assessment, early diagnostic clarification, so that we can start treatment with the plaster cast very early, reduce how much the foot shape changes, and hopefully that should give one a good quality of life, an ability to live life to the fullest, even if he can't change the condition. Scientists have investigated many different products, drugs in particular, for the management of Charcot. There are drugs that work on the bone and reduce the osteoclast. These are cells within the bone that eat away older bone and pave the way for newer bones. And hyperactivity of these osteoclasts has been proposed as one of the pathway why the bone does not sort of heal in a phased manner. But none of these drug treatments have really shown valid major disease altering capabilities as yet. And that may be because we only studied patients with advanced Charcot perhaps in the past. But certainly research is very limited at the moment to prove the absolute benefit of disease altering or Charcot disease process altering medications.